Workplace Violence and Depression, Research Proposal. Introduction. Workplace violence is a growing problem and is recognized as a critical safety and health hazard in the United States. Injury caused by accidents and violence in the work environment has been regarded as a significant social problem. However, organizations can deal with accident and injury cases by instituting safety measures. Importance of the study. This study will provide an in-depth analysis of workplace violence. This is useful and informative for psychology students and also for individual workers and employees who experience workplace aggression and mistreatment by supervisors. How should organizations deal with workplace violence? Organizations should deal with workplace violence and must institute policies and programs to provide and encourage an atmosphere of friendship and good camaraderie in the workplace. Workplace violence causes depression on the part of the victims. It has been considered a serious problem that can cause more psychiatric problems. Who is involved? Supervisors and those who exercise control over others are involved in workplace violence and aggression. Even employees harass and commit aggression against their fellow employees. Studies have found that perpetrators of workplace violence are former victims themselves. Outcomes of exposure to violence and verbal aggression are related to poor physical and emotional well-being. Terms definition. Depression and anxiety have caused mortality and are related to quality of life and social functioning. Workplace aggression refers to acts that harm the psychological, mental, or physical well-being of individuals in the work environment. Workplace aggression is defined by Hershcovis et al. As a psychological form of mistreatment that involves negative acts perpetrated against organizational members that victims are motivated to avoid. Workplace harassment may be in the form of yelling, cursing, temper tantrums, withholding information and resources, public humiliation, and similar behavior. Harassment can be aggravated with physical aggression. Qualitative studies on workplace violence. LeBlanc and Kellaway provided a compilation of 22 situations related to exposure to violence. The situations were tasks that needed exercising physical control over others, having contact with people on medication, or having to care for others. Schatt and Kellaway also noted the relation between combined violence and verbal aggression and exposure in both forms of well-being, but the relationship is stronger if the offense is committed by a coworker than by a member of the public. Barling, Rogers, and Kellaway found an inconsistency in the literature such that verbal aggression was related to psychological factors and not violence. Support by workers reduced psychological strain, according to a study by Schatt and Kellaway. Conclusion. Workplace violence and harassment affect the psychological and physical well-being of employees, including their professional lives. Individual careers will be deeply affected. As employees think of coping with harassment and violence, some may decide to resign from their current position. But the physical and psychological will remain in the individual. A perceived violent climate can be reduced if the management exercises control and provides ways to eliminate violence and verbal aggression. Policies and procedures should be provided to deal with violence by providing training on avoidance and management of violence. A favorable workplace environment should emphasize how employees should behave, can provide a wholesome relationship among the employees and encourage them to work for the success of the organization, rather than do something that may hurt fellow employees. Employees should behave more civilly so that minor rudeness does not escalate into more serious interpersonal encounters.